Collaborative services, improving the health and quality of life of care home residents. Digital solutions, the Spanish care model leading the way in connected healthcare. And crossing generations, the care home that's welcomed an on-site nursery. Hello and welcome to Shaping Tomorrow, a programme from Care England and ITN Productions. I'm Matt Barbett. During this programme, we'll be exploring the future of health and social care and the challenges facing the sector. We'll meet the people behind the country's latest developments and see how new technology is changing people's lives. First, I'm joined by Professor Martin Green, Chief Executive of Care England. Martin, it's good to see you. Thanks for coming in. With budget cuts and a shortage of staff as well, what does the sustainability of care look like?
I think the care sector is going through a particularly difficult time at the moment, and I think if we're going to sustain ourselves into the future, we have to find the solutions. And it's not going to be about what the government does, but it's going to be about how creative we are, and particularly how we use our staff much more effectively and more creatively. We might need regulators to help us in that, so that the regulatory system enables us to use staff in more creative ways.
Focusing on staff, how can the workforce see what they do as more of a profession?
I think this is a really skilled sector, and I think what we should see is a parity of esteem between care workers and those in the NHS. If you look at the people that are looked after, they're pretty much the same people. So what I'd like to see when we talk about integration, I'd like to see it starting with training, with esteem, with access to budgets around support, so that people can have careers that go across the NHS and social care.
Can you tell me more about the upcoming Green Paper and what care is going to look like over the next 50 years?
Well, we hope it's going to be a green paper, but the government hasn't really published its plans yet. But I think what we need is a 50-year view about social care, and we need to understand that the world is changing, that demographics are changing, that we're having to face a situation where there are going to be many more people in need. We're going to have diversity of services, so we want to see good community services. We need health services supporting social care. We need specialist services for people living with dementia, for people with learning disabilities. So what we need is a root and branch reform and a long-term vision for social care.
And Martin, on those challenges, those diversity challenges in the 21st century, it's difficult, isn't it, with the population growing?
It is difficult, but we should remember that services should respond to people, and the whole of the personalisation agenda is about how we make sure services are appropriate to individuals, and that individuals should not be slotted into the services that we have. What we should be doing is providing services that are flexible enough to meet people's needs. And now if we do that, one of the things we'll see much more efficient use of resources, because we'll be providing things for people that they really need rather than what we think they need.
Professor Martin Green, many thanks.
Thanks.